In previous videos, we've talked about applying theoretical ideas to understanding COVID-19 and the fear it produces. And we've talked about ideology and power. We've talked about moral panics. And today I want to talk about another theory that you might use to explain how media create a sort of like, I suppose, push our experience of COVID-19 in terms of how we feel about it and what we think, why we think it's significant in a particular direction. And we're going to do that through the theory of agenda setting. So we've already talked about moral panics. Agenda setting is a theory that is often used and much misunderstood, I think, as a way of explaining how media stories have an influence on the worlds of public opinion and public policy. Now, the thing to there's a couple of things where people really go wrong with agenda setting. And one of them is to frequently define agenda setting as the concept that media don't tell us what to think, but they do tell us what to think about. And although that's one of the premises from which agenda setting research began, it is an inaccurate representation of how agenda setting develops as a concept and how it works today. So don't use that quote as a summary of agenda setting. Agenda setting is something which is a body of research that's now been evolving over 40 years or so. So the idea that you can summarize it in one pithy quote like that is pretty silly, and it's something that you really shouldn't do. So one of the founding figures in agenda setting research is a guy called Maxwell McCombs. Again, he's been working on this for 50 years now. He's still with us. He's still working. So you can't summarize the work of this paradigm in one quote like that. But I suppose agenda setting theory wouldn't normally be related to theories of ideology. But what it is about it expresses the ideas that media actively process the social world in a way that ends up affecting that social world through the ability to mold public opinion and therefore public policy. And the idea behind agenda setting is that essentially any one social problem is a complex beast. And if we're thinking about the fear and panic that's provoked by COVID-19, one of the things that we know very quickly is that there's actually one of the things that makes COVID-19 so frightening is the fact that there's more than one thing to be frightened about. So one of the things that we need to do when we're thinking about COVID-19 is sit down and think, well, when we're afraid of this, what exactly is it that we're worried about, that we're afraid about, and how should we rank order those fears? And what agenda setting essentially does is it explains how the media do that work for us. How agenda setting essentially argues two things. Firstly, that media thematize social problems. They tell us what those social problems represent. But then within those themes, agenda setting also rank orders those themes. It tells us which themes, for example, are the most important things to worry about and which are not. And the argument is that in building those themes, in identifying, publicizing, and rank ordering those themes, the media drive political agendas. They tell audiences, publics what they should worry about, and this has an influence on the world of public policy. Now, of course, one of the things that's quite that we need to be really careful about is This happens through media, but it's not necessarily driven by media industries. So quite often we can have political interests, politicians, other kinds of important, powerful social institutions which work alongside media to create a public agenda. And that's actually something that Stuart Hall wrote about in his work on law and order very early in his career. The way that media, courts, judges, police forces, all work together as primary definers of certain approaches to crime and criminality. But nevertheless, we have this idea that media affects social reality by processing social problems into themes and sub-themes. And in telling us what themes to pay attention to, they also substantially tell us what we should think about a particular event. Now, I want to give you an example from the United Kingdom that happened very recently in COVID-19. And this has spread to other parts of the world. But there was a movement in the United Kingdom which encouraged ordinary people to stand outside of their houses on a particular night and applaud. And the idea was that this applause was for frontline care workers, particularly nurses, doctors, carers, cleaners, anybody who works for British hospitals, and thank them for their work in attending to COVID-19 patients. And this became a somewhat ironic event in that certain commentators saw this as being something of an exercise in hypocrisy, that people who had just voted Boris Johnson's administration into the House of Commons were applauding workers whom, the argument went, the Boris Johnson's party had actively undermined in two regards. Firstly, in not funding the healthcare system adequately, secondly, in not paying them adequately, and thirdly, in the view of officials for the medical journal, The Lancet, in not actually presenting them, giving them World Health Organization quality protective gear with which to fight COVID-19 patients. So what happened very quickly, not necessarily through mainstream media, but through social media, was that a campaign which even Boris Johnson joined in with, he was pictured outside Number 10 clapping his hands. But what you rapidly began to see through social media was the way that many social media users created an alternative agenda whereby this particular response to COVID-19 became an exemplification of a broader hypocrisy toward the health services in the United Kingdom. So in this case, what we can see is the way that social media users changed the agenda of COVID-19. So COVID-19 changes agendas from being a story about a global pandemic to being a story about inadequate resource management amongst certain countries in the West. So it turns from being a story about disease into a story about government failure. So one of the things we can see then is that media create reality in this sense by allowing social media users to change the public agenda regarding the meaning of the COVID-19 virus.